So let's come back to where we are and what we have to do. Your staff that you're hiring are going to be trained. They're going to be given suggested scripts to ask questions about. And the key thing with contact tracing is not that you memorize a script. It's that you convince people that you're talking to that you're actually trying to help them. The best way to learn how to do this is to actually get experience doing it. But remember, your organizations and your staffs, I don't care whether you're working around education or homeless issues or unemployment, I don't care what social services you all normally work in, mental health, you already have these basic skills of gaining people's trust and working and listening to them, most importantly, to figure out a way in which you can help them with your resources. And these are the skills that we need in this core. We need those skills of your organization in knowing and understanding the communities where you are seated and communities that you serve, and understanding that your staff is able to be flexible and rise to the problems and occasions that are going to present to them. So when you think about the challenge before you, then you have to learn what expectations you need to have. And you have to deal with the realities on the ground, not just what we are forced to often bureaucratically address. Let me give you some examples. Now, in order for contact tracing to be really useful, someone has to be able to bring in information from all of these different efforts that are going on. That job belongs to the health departments, plural, not just one health departments, plural. So be aware that how quickly you get information from the health department and how quickly you give information back to the health department becomes important. But you know, and I know, that if you have a case that's in Little Village, for example, that particular contact that you've been given the name for could easily have a grandmother that's living in Berwyn, right? We know that, which is not in the city, or Cicero. Okay. So you need to ask what's going to happen when that happens. You know, if I get a name from South Shore, my sister may be living out in the southern suburbs in Flossmoor. And those are those lines of division which exist on our little bureaucratic maps and our little bureaucratic protocols, but they don't exist in the real world. I may work on the south side and live on the north side. So what happens when you have people moving around in the real world, and what is your organization supposed to do with that? How are we going to get that information to flow? This is one of the big issues. Another big issue is, let's say I'm a CTA bus driver, and I become positive, but my elderly father is living with me. So what do we do in that setting? Is it possible for me to be quarantined from him? Who's going to take care of him? Who's going to fix his meals? So these are questions for which they're not easy solutions or answers, but they're questions you have to be not afraid to ask and not too afraid to insist that we have something that makes sense. Please don't be intimidated by what you perceive to be too technical information. At the bottom line, this is common sense information. The answers may require some technical skills, but the basic questions are common sense. And if you don't speak up and say, what are we going to do about this problem or that problem, they won't get addressed and they won't get answered.